Greetings, and thank you for spending a few minutes with myself. And I'm very pleased to welcome and introduce to you Dr. Rebecca Pedersen. And Dr. Pedersen has been with FHN for 20 years. She's also our Chief Quality Officer, as well as a full-time family practice physician. Dr. Pedersen also has achieved recognition as the Illinois Rural Physician Excellence Award recently, and we're really pleased to be able to introduce her to all of you and share a little bit more about what's going on at FHN from a physician's perspective.
Yes, we have rescheduled some of our procedures. If they're elective and non-emergent, we're following the guidelines that would be given to us by the Center of Disease Control and Prevention, the Illinois Department of Public Health, the Illinois and American Hospital Association. For example, a knee replacement would not be an emergency, could be safely postponed for a month, and so we're taking this time to keep our patients safe and reschedule those surgeries that are not emergencies. We want you to know, however, that we're here to care for you if you have urgent needs. So many things are still happening here at FHN in a safe, effective way. Some of our patients require treatments for their chronic diseases or a complete recovery of a recent illness. For example, if I was a cancer patient, I'd want my radio active treatments and my IV chemotherapy to continue. If I was discharged from the hospital and I had an infection, I might need some continued IV antibiotics, perhaps a blood transfusion. These are life-saving treatments that we should not interrupt because of the COVID pandemic. So many chronic illnesses can wax and wane. And if you're having a decline in your health and you're thinking, wow, this could be a while before I get into my doctor, that's a statement that we want to not promote. If you need our help, we're here. For example, if you had congestive heart failure and you noted that you were gaining weight and short of breath, you'd want to pick up the phone and call us right away. Because if your body is in a weakened state and you come in contact with COVID-19, it would be harder for you to completely recover and do well. If we hear from you, we can help you feel better quicker and heal faster. And we'd rather hear now from you rather than a delayed phone call that could be life-threatening to you. So we're always a phone call away. You can call our offices that are open and staffed by our nurses. We can answer questions over the phone. We also have a portal through our electronic health record where you can message your provider and share questions and answers back and forth. We have supportive care nurses, complex care managers. We have people who check in on your condition when you're at home. We also have remote monitoring of vital signs. It's called remote monitoring. So we still can know how you're doing at home, even though you may not choose to come into the clinic or the hospital to see us. We've divided our hospital into isolation and non-isolation rooms. Our COVID-19 patients are cared for in a separate area of the hospital to keep everyone safe. We also have plenty of PPE that we've given our staff and providers to use while they care for patients. Not everyone needs to use an N95 mask, but if it is required, we have plenty available for our staff. You might notice that different providers are working in the hospital, and they're assigned to a certain unit. This is our way of not getting patients contaminated by having one provider move around different areas of the hospital seeing patients. We have ultraviolet light therapy called a Trudy machine that cleans all of our rooms. We were doing a fabulous job before the pandemic, but we've even ramped up our Trudy treatments to clean the inside of our facilities and patient rooms. Our lab has been deployed to a different location. Instead of coming into the hospital and bringing more foot traffic here, we've moved that facility lab draws to Burchard Hills Clinic. And one more interesting thing. You might notice that our drinking fountains have all been shut down. This is one way that we're thoroughly watching out for your health and making sure that you don't pick up a germ while you visit our facility.
Well, I can assure you that we're welcoming everybody and all the families in our FHN community to continue to seek care. And while some of our office locations are closing, that's really to accommodate the decrease that we've seen in volumes. So a lot of people are staying home, and of course we've had to reschedule many procedures and many visits due to the coronavirus pandemic. We are learning that we can start to resume some of that care, and we certainly want to make sure that we see people that have needs. So those offices, the hours are being staggered or they're being rotated amongst them so that we can staff locations that are a little bit fuller and also space out the appointment times to make sure that it's safe for our patients to come into our offices. So we are here for you. The best way to be able to know which office to go to is to call the office and find out what office hours are available and also what your needs are so that we can best direct you to the location that can serve your needs the quickest and also the most appropriately. So do feel free to call your regular physician's office or to call our main number, and we'll be happy to connect you and make sure that we can get you taken care of. In our emergency room, we are still running a 24/7 emergency department, and I do encourage people, if they have a need, to continue to seek care through our emergency room. We've seen a significant decrease in our volumes, and unfortunately the people that are coming in are sicker than ever or need care more acutely than ever. And if we would have been able to treat those patients or seen them sooner, perhaps it wouldn't have been as significant of an illness or an injury, and we could have provided a little bit less intensive plan. We are hearing from our emergency medical services providers that the calls that they're getting are really now for people that have kind of gone beyond the early warning signs where things would have been easier to take care of and are much more severe as they're coming into our emergency department. So we want to ensure that as people think about their health is that they do continue to seek services, and we are running just as open with all of our services in the emergency department as we ever were. At present, we are holding on elective cases, so those are surgeries that are deemed to be non-urgent or non-emergent. Of course, we are making exceptions for any cases that are medically necessary and where delaying that care may be more detrimental to a patient than not. So we will continue to provide those services as well as the full scope of services that we have to offer as a hospital and our physician practices, our cancer center, hospice, and any of our other areas of treatment are available for people to continue to seek care. With the governor's recent extension of the stay-at-home order, he has also issued guidance to the Illinois Department of Public Health to allow us to start doing some elective cases in May. So we will be opening up our operatory to be able to do more of those cases. We're just currently waiting on guidance from the Illinois Department of Public Health on what kind of cases we can proceed with scheduling that would be elective. My hope is that FHN is able to return to our full scope of operations with hours and procedures and processes as soon as possible. But first and foremost is making sure that it's safe for patients and safe for our staff to be able to provide all of those services. We want to make sure that we're not rushing too quickly into getting back to full operations in compromising the way that we provide care and the utmost safety for people. So we want to be very purposeful about how do we do that and take a very methodological type of approach to that reopening. But my hope is to be able to do that as soon as we possibly can, as guided by our governor and our local health department officials. As always, people are encouraged and welcome to visit our website at www.fhn.org, where they can see a lot more of what's happening within our organization. There are radio interviews, there are the video interviews, such as the one today with Dr. Pedersen, lots of resources, an online screening tool, information tracker. They can find out the latest about what's going on with the coronavirus in general. And all of the information on that webpage is factual and taken from very credible sources, which we encourage for people to utilize so to avoid misinformation that's being posted or listed online elsewhere. So we encourage people to visit that site on a regular basis. And of course, they can always call their provider office to try and learn more as well. There are a number of things that I'd like to talk to the community about. First and foremost is I'd like to express my gratitude for all of their support during this time, for the many healthcare workers and the many essential workers that we have throughout our community. It is truly appreciated, and it's a blessing to live in Northwest Illinois, knowing that we are such a tight-knit community. And I can't say thank you enough to all of the people that are sacrificing to provide for others each and every day. Another probably word of encouragement that I would share with this community is that we're going to get through this, and this is a time that will pass, but it's really important that we stay safe, that we make sure that we're maintaining those social distancing guidelines, that we're adhering to washing our hands, not touching our face. And I know it gets tiresome, especially when we're not able to go out and to do the things that we're used to doing day in and day out. But understanding if we take these precautions now, we could potentially save somebody's life. And the sooner that we can slow and halt this spread, the easier it is for us to get control of it. The coronavirus is something that we're going to have to deal with potentially for years to come. And the biggest push for us right now is to make sure we can get ahead of it so that we can control it and be able to keep all of the people we care about safe and, again, value our loved ones. I would also issue a word of caution. We have been made aware of a number of phishing campaigns or email campaigns trying to trick people into providing information and especially misinformation about coronavirus financial relief and funding. And I would ask our community to be very cautious of dealing with companies that you don't know personally or that you're not assured are very reputable companies. That's happening with phone calls, with mail, and they seem very credible at the time. But once again, if it seems too good to be true, it probably is. So let's all look out for each other, especially those that are being socially isolated right now, that are looking for that contact. And there are sadly people that are trying to take advantage of that. On another more positive note, it's getting to be great weather to go out and to enjoy some nature walks, some hikes, biking, and really see what a beautiful area and a beautiful community that we have. And I would ask our community to make sure that you're supporting local businesses, is that we're all going through a lot of significant challenges during this time, but one of the things that we can count on is each other, and that means shopping local and supporting local businesses.